When you call 999, you'll be connected to an emergency call handler. You'll be asked if the patient's breathing and if the patient's awake, followed by what the problem is with the patient. This is to allow us to quickly identify patients whose conditions are life-threatening. Following this, the call handler will ask for the address and telephone number which you're calling from. The call handler will then ask a set of questions appropriate to the patient's condition. If the symptoms given are life-threatening, these questions will not delay an ambulance response. Your call will be coded with one of the following categories. Category 1 calls are life-threatening illnesses and injuries. Calls would include cardiac arrests and serious anaphylaxis. Category 2 are for emergency calls. Calls of this nature would include chest pains and stroke. Category 3 calls are urgent calls, needing a response in 120 minutes 9 out of 10 times. These calls will include traumatic injuries and calls such as abdominal pain. Category 4 calls are less urgent calls, which will be responded to 9 out of 10 times within 180 minutes, or will be managed by a clinician within the control room who will be looking to make an assessment of the patient's condition and get them the most appropriate help. If the patient's condition worsens and you call back on 999, it's important to remember that we will re-triage all calls. This is to assess any change in the patient's need.